Everybody, it's Dr. Forth, and today I'm actually going to be talking about knee problems. One of the things that can happen with the knee is developing degenerative joint disease or arthritis. In this case, usually it's going to be one-sided if it's degenerative joint disease. And good exercises for that, I like to tell my patients to use swimming because it helps to support the joint. You have decrease in weight bearing because of the buoyancy in the water, and it also provides some resistance. So that's a good one for that. Excess weight or previous injury can predispose you to developing this kind of joint problem. Since the bony tissues of the knee joint don't provide a lot of stability, you just think about it, you have the bone of the thigh and then the lower leg coming together for the knee joint. And yes, you have the kneecap, but there's not a socket or some kind of bony structure to provide stability for that. So a lot of the stability of the knee joint comes from soft tissue structure, and sometimes these tissues get irritated. One of the common injuries that happens is called an ACL tear. ACL is anterior cruciate ligament. So cruciate because there's two ligaments that cross kind of an X-like shape inside the knee. And the ACL, or the anterior one, is the one that is more likely to be injured. This usually comes from activities with lots of stops and starts, explosive movement, or changes in directions like soccer, basketball. The meniscus is little pads of cartilage inside the knee, and meniscus injuries usually happen from turning or twisting movements on the weight-bearing leg. So if you're carrying weight on that side and then you twist and turn, you can tear the meniscus. Usually when meniscus tear happens, a little piece or the torn part of that flap kind of rolls up and it can cause locking in the joint. These types of injuries, the tearing of the ACL or the meniscus, those are usually surgical cases. Although, depending if it's a minor injury to the ACL, you might not require surgery, but most of the time, surgical cases. So after the joint has been repaired, then you can work on strengthening the area, improving your proprioception. That means how your brain knows where your body parts are so that you are very efficient with your movement. So you would do things like maybe balance board exercises to help improve proprioception. We also want to strengthen the other soft tissue structures to prevent injury. I like to use some of my favorite things. Kinesiotaping and red light therapy are both great for soft tissue and joint issues. So I use those in my office. Of course, proprioceptive training, chiropractic adjustments. Did you know that it's not just for the spine? You can actually adjust extremity joints as well. And so that is an important tool. There's something called runner's knee or the tightness of the IT band. Now, we talked about that with the hip joint videos because the IT band is actually a fibrous connective tissue band. Starts up at the hip as a little muscular area, and then the band extends down the outside of the leg and attaches just below the knee on the outside. And if this is really tight, it can snap over the knee or be really tight over the knee, particularly with runners. So the pain from that can be either at the knee or the hip area. And I talked about that in the hip video that I had posted previously. We have little fluid-filled sacs around the joints, not just the knee, other joints as well. These fluid-filled sacs are called bursa. They're like little cushions between the soft tissue and the bones or between layers of soft tissue. And when we are putting pressure on those from repeated compression or trauma, acute compression, they can get injured and inflamed. And that's called bursitis. It is extremely painful and localized to that particular area. Now, one of the things that happens with the knee to cause bursitis, frequent kneeling or direct pressure. So if you are going to be doing work that requires a lot of kneeling, you can actually get the knee pads. There's a couple of different types. There are ones that are really just like little foam pieces that strap onto the knee. And then there's also one, they have a hard plastic shell and a sort of squishy material underneath. So that's a little bit stronger protection. You can also get, for example, if you're gardening, or doing other activities that require kneeling, you can get a little mat to kneel on that'll help take some of the pressure off of that. So that's going to help you avoid having an episode of bursitis. Another condition, chondromalacia patella. What a mouthful. What that really means is we have softening of the cartilage underneath the kneecap. So the pain is noticeable kind of inside the knee or under the kneecap. We would notice it on hills or on stairs, which is kind of like the same thing as the hill. What's really happening is we're getting breakdown of that cushioning cartilage tissue that's underneath the kneecap. And the reason it happens is usually because the muscles of the thigh are not contracting as firmly as they should. So the kneecap is having more free movement than it's supposed to. So if we imagine this is my leg and here's the knee, okay? When we straighten the leg, these muscles on the top of the thigh are supposed to contract and pull the kneecap tight against that knee joint area. Now, if they're a little bit weak, the kneecap can move more than it's supposed to and cause irritation to that cartilage, which over time leads to breakdown of the cartilage. And so you really want to make sure that you strengthen those quadricep muscles, and you can do that with extension of the leg. And also when the leg is extended, then you can raise the leg up. You could do these while seated. Just make sure you're not in your super comfy, squishy TV watching chair. If you're going to do seated exercise, it's best if you have a nice firm chair, like maybe a kitchen table type chair, right? That's got a firm seat, not squishy. So strengthening the quadricep muscle, you can also find probably at the grocery store in the area where they sell braces and splints. There's something called a CHOPAT, which is essentially a band that goes around. Now be careful of this because you don't want to constrict blood flow. So if you have any kind of vascular issues, this is probably not going to be a good choice for you. Definitely you can check with your provider to see if it's appropriate. But this little band basically goes around and it's kind of a quick fix to tighten up that tendon that holds the patella. Of course, the long-term solution is to strengthen those quadricep muscles. So you probably want to focus on that. So a lot of these things that I've mentioned, sometimes it might be a surgical type case. If there's a tear of the tissue, obviously that needs to be repaired before we can do any kind of strengthening exercise work. So, and if the meniscus is torn, that little flappy bit is going to roll up inside the joint and cause problems. So they have to go in and remove that little bit. So you might need to have a surgical consult, but then after it heals, there's a lot of things you can do to protect the knee and prevent future episodes of problems. I already mentioned that I really like the kinesiotaping and also red light therapy. You can do Epsom salt soak. to help relieve swelling and discomfort. And if it's not convenient to submerge, the knee can be kind of tricky. It's not like foot or ankle to submerge it. I learned a cool trick from a massage therapist friend of mine. It's kind of like fake Epsom salt soak. So you lay down, you put a towel under the knee, and you moisten the area. Then you sprinkle Epsom salt crystals on it, and then put a warm, moist towel over the top. Kind of like Epsom salt soaking, only without submersion. Now, careful because you don't want to make it too warm, right? It should be just tepid or slightly warm when you're doing the Epsom salt, whether it's submersion or the fake submersion alternate method that I mentioned. Of course, we want to also make sure that the proprioception, that's the brain knowing the location of all of the body parts, is in order, and also make sure that the joints are lined up correctly. Chiropractic adjustments are great for this. Proprioceptive training. I have something in my office, a balance board. So the board sits on top of a little ball, and I can use one ball or multiple balls. And the board has a tipping, or sometimes it's even in multiple axes movement to help train your brain to make sure and make efficient use of the body part. So those are good methods. Some general guidelines for helping to prevent knee problems, of course, maintaining appropriate body weight, not just for the knees, but all of the joints in the body are under stress that is increased when you have excess body weight. Making sure you have good mechanics. So if you're doing an exercise like a squat, or anything where you're going to be bending over and bending your knees, make sure that your knees stay behind your toes. When you just bend over, if you're not paying attention, you look and your knees are bent and they are well ahead of your toes. So if you're going to do squats or other bent knee type exercises, focus on bringing your pelvis back as you bend your knee so that you don't have your knees up ahead of your toes. Make sure that you have the seat height adjusted correctly for your stationary or regular bikes. You want to check, and a lot of bike shops will do that for you. They'll fit it. But if you have to ship it and it gets changed, make sure you go back and adjust it to the appropriate height of the seat. Stretching and strengthening is very important. So every time you put the joint through range of motion, it stimulates the membrane around the joint to bring a rush of new lubricating fluid and nutrients to that joint tissue. So movement is important. I talked about how people with DJD can go swimming. So you have that buoyancy that kind of helps to take some of the weight bearing off of the joint tissues, but you also get some added resistance. So that's a great thing. Some good knee exercises specifically. One of the very first easiest knee exercises, in fact, they recommend this for people coming out of knee surgery. It's called a heel slide. So you're going to be laying down and your legs are straight out in front of you. And now you're going to bend your knee, and while keeping your heel in contact with the floor, just bend your knee and slide your foot up, and then slide it back down until the leg is straight. You want to do this in a slow, controlled fashion. Sometimes if the foot is not sliding really well, you can put a plastic bag, like a grocery bag, over the top of it. And the key is controlled, slow movement. So that's the first, probably the easiest of the knee exercises. We talked about leg extensions and even straight leg raise from the extended position to strengthen those quadricep muscles. You can also do bridges either from directly on the floor or with one of those exercise ball. And from the bridge position, you're going to extend one leg at a time. So that's bridging with knee extension. Sit to stand. This is a good one for anyone who has trouble rising from a seated position. Make sure that you use proper mechanics. So you might have to scoot a little bit out, kind of closer to the front of the chair. And then you're going to really use your legs to stand up slowly and carefully. Good to practice starting with a chair that has some arms, okay? But as the legs get stronger, you'll be able to do a better job with that. Side stepping, so just walking side to side, and you can add a resistance band. So one of those stretchy bands, they come in a circle, or you can cut strips and just kind of tie it into a circle. It should go just above the ankle. Start with no band at first and then a light band to do your side steps, both sides. So those are some good ideas to help protect your knees and keep them nice and strong so you can continue to enjoy your activities. Make sure you like and subscribe to see future videos.